Hey guys, welcome back to my channel. I'm Savannah and I'm so glad to have you here. You're tuning in for a very special day because this is our first Wellness Wednesday, the time we talk about keeping yourself healthy and well in the most non-toxic way possible. And today we're talking about something that all women and most men know about: birth control. When my first son was born in 2015 at 6 weeks postpartum, I immediately went to my midwife and chose a birth control. At that time, I chose the Depo-Provera injection, which I ended up having some awful side effects and reactions to, and that's another video for another time, but it was completely terrible and I will never ever take that injection again. So the way that the Depo shot works is that you go every 3 months to get another shot. The birth control lasts for 3 months, and so at 3 months after my 6-week appointment, I went back to choose another birth control because I definitely wasn't going to do the Depo injection again. And then at that point I was still breastfeeding, so I chose the mini pill, which also gave me awful side effects. And when I finally came off the mini pill, which was just a few months before I conceived my second son, I had decided at that point, my husband and I actually both decided that I was never going to take conventional hormonal birth control again. When I was pregnant with my son Jackson, as I was nearing my due date, I started researching birth control options again, and so then I became interested in the Paragard IUD, which is non-hormonal. So I did a little bit of research on that and then found out that because of my nickel allergy, it wasn't recommended. It's not recommended that anybody with any kind of metal allergies receive this type of birth control because it releases copper, and people who are allergic to other types of metal, especially like nickel, are more prone to eventually have reactions to the copper that's released. So at this point I was kind of in between a rock and a hard place. I was confused. I didn't really know what to do. Since I was like 9 or 10 years old, I first discovered birth control, and honestly from that point on it was pretty much normal to me. Like, women were on birth control. If you wanted to prevent a pregnancy, that was the only way that you're going to do it, is through birth control. And the biggest thing about birth control that I feel like has really started bothering me, that I've realized myself because of my own experiences with it, is that everybody knows about birth control. Everybody knows that the birth control options that are available, and everybody even knows that birth control isn't 100% effective, that there is possibility that you could get pregnant with it while you're on it. But not that many people know about the side effects. I know for me, myself, anytime I went to go get birth control, nobody told me really any side effects. And when I was getting the pill, the doctor did tell me, you know, not to smoke because it made you at risk for blood clots or stroke or something like that. And I didn't smoke anyway, so it didn't really apply to me. But nobody really told me the things that it could do to your mental state and the way that your emotions are, and all sorts of things that birth control really affects that a lot of people don't trace back to it because the side effects really aren't that well known at all. The truth of the matter is, women just aren't presented with any alternative options, even though they do exist. So most people believe that the only way to prevent pregnancy, if you want to avoid birth control, is abstinence, which simply is not true. There's scientific evidence on many natural forms of pregnancy prevention that have been proven at least as effective as pharmaceutical offered birth control. So what are the problems with birth control? What things might you need to know before you actually choose which birth control option you want to go for? According to the FDA, there are several types of reversible birth control options available. And all of these, I mean all of them, have the potential to come with unwanted side effects. These side effects can range from headaches, irregular periods and cramping, to even the more severe uterine perforation, ectopic pregnancy, and even stroke. As I said before, all forms of birth control besides the copper IUD, the Paragard, contain some form of synthetic hormones. These hormones aid in preventing pregnancy by almost tricking your body into thinking that you are actually pregnant. But with your body already naturally producing these hormones, you have to stop and wonder what these synthetic versions are doing to a woman's body and her ability to conceive in the future. Many medical professionals have long been interested in the link between hormones and mental illness. And in fact, a recent study in Denmark found the use of hormonal contraceptives could greatly affect mental health. Researchers actually discovered that After just 6 months of use, women and especially adolescents were at a 40% increased risk of developing depression than women who weren't taking synthetic hormones. And the sad thing is, mood disorders are only the tip of the iceberg. Since 1980, scientists have recognized a potential link between hormonal birth control and liver issues, including tumors of the liver and even liver cancer. The main reason for this is because it's up to the liver to break down these synthetic hormones. And because they aren't naturally occurring, this process can be extremely taxing on the organ. And the scary part about that is disrupting the liver can have an impact on the entire body. Take the gallbladder, for instance. The gallbladder's main job is to take bile created by the liver and store it. So when the liver's affected, the gallbladder often is too. In fact, Dr. Lewis from Brattleboro Memorial Hospital says that gallbladder surgeries are on a significant rise in the United States. And the most interesting part, the patients are getting younger and younger by the year. Gallbladder disease disproportionately affects females over males, and the National Institute of Health has discovered that one reasoning for this is because of the excess estrogen introduced in the body via hormonal birth control. The National Institute of Health says that this extra estrogen can increase cholesterol levels in bile and decrease gallbladder contractions, which may cause gallstones to form. Hormonal birth control has also been documented of robbing women blind of vital nutrients and vitamins such as zinc, B12, B6, and vitamin E. Scientists are also beginning to examine the link between synthetic hormones and bone health. This study pointed out the potential for long-term hormonal birth control, and long-term literally just means 2 years of use. Most women are on hormones for a lot longer than that. But this showed the link between the synthetic hormones and their ability to reduce the density of a woman's bones. This is really concerning because women are already at a higher risk of developing osteoporosis than men. Really, when you think about it, it's hard to come up with a way that synthetic hormones don't affect us. The American Cancer Society actually categorizes oral contraceptives in the same group as tobacco and formaldehyde, a known human carcinogen. In fact, hormonal contraceptives actually have the ability to interfere with the very way we choose our life partners. A woman's natural hormones impact the men that she happens to find attractive and wishes to mate with. For instance, when a woman is ovulating, science has shown us that she seems to prefer more masculine features and a partner that is genetically dissimilar to herself. However, women taking hormonal birth control miss out on those fluctuating hormones, which can effectively have long-term consequences on the ability of couples to reproduce. What about the non-hormonal options of birth control? Are those safe? With the introduction of IUDs or intrauterine devices, many women have turned to these longer forms of birth control. Because many women react badly to hormonal birth control, they believe that they will have a better experience with choosing Paragard, a non-hormonal IUD. Unfortunately, as more research emerges, we are beginning to understand that the Paragard IUD may not be a better version after all. Instead of hormones, Paragard releases copper into the woman's body slowly over time in order to prevent pregnancy. It's placed in the uterus by a physician and can stay there for up to 10 to 12 years. Many people wonder how copper released into the uterus actually prevents pregnancy. And honestly, that really is a very good question. As with any heavy metal, one may be concerned about its effects on the human body, and also the potential to contract something called copper toxicity. The way Paragard works is because copper is an extremely effective spermicide, inhibiting the motility of the sperm and even detaching the heads of the sperm from their tails. The copper IUD also increases the amount of prostaglandins produced, which also helps sperm from reaching the egg, but this can cause inflammation during the menstrual cycle. As a woman sheds the lining of her uterus, prostaglandin secretion is already increased to help the uterus contract and release all that's inside. Because it's increased to a more unnatural level, women with the copper IUD are at an increased risk of more severe cramping and heavier bleeding during a period. Anemia, breakthrough bleeding, or bleeding between periods, vaginitis, and even pain during intercourse. And while science has shown that many of these issues may get better over time, within about 3 to 6 months, many do not. There's also the risk of the IUD not being placed correctly or becoming dislodged and traveling somewhere else. This can result in IUD expulsion, uterine embedment, and even uterine perforation. So if all the pharmaceutical options have so many problems, what are the natural alternatives? Well, the first one is the withdrawal or the pull-out method. So the pull-out method, also known as coitus interruptus, is one of the most commonly used natural forms of pregnancy prevention. It's also one of the most frowned upon because when not done properly, it can result in an unwanted pregnancy. This method relies purely on the self-control of the man and is done by withdrawing the penis from the vagina and away from the female's external genitalia prior to ejaculation. Often, this birth control method is looked at as better than nothing, but really not very effective at all. Contrarily, studies have actually shown that when conducted properly, as with almost any form of birth control, the withdrawal method can actually be nearly as effective as the male condom. According to research done in New York, if the man withdraws before ejaculation every time a couple has vaginal intercourse, about 4% of couples will become pregnant over the course of a year. That means when done correctly, the pull-out method could be upwards of 96% effective. That number really comes as a shock to many. Of course, we've all heard about the dangers of pre-ejaculate, and that's actually where things get interesting. 2 studies conducted in the United States found that most samples of pre-ejaculate didn't contain any sperm at all. And what about those small samples that did? The sperm seemed to be immobile. Many other studies have actually backed this finding, and according to the National Institute of Health, to date, no study has found motile sperm in the pre-ejaculate. Speaking of male condoms, that's natural birth control option number 2. Pretty much everyone knows about these guys. They're easily accessible, fairly convenient, and when used correctly, about 98% effective at preventing pregnancy. One reason condoms are so well known is because they're not only used as a birth control option. They can help prevent the transmission of STDs and are often recommended in people having sex outside of monogamous relationships. One issue that can be associated with the male condom, though, is women contracting an infection. Not a sexually transmitted infection, but research has shown that condoms coated in spermicides do increase a woman's risk of developing a UTI. Lubricants on the condoms have the potential to disrupt the pH of the vagina, which could result in a yeast infection. Some condoms even contain toxic ingredients, like the cancer-causing N-nitrosamines, which can be released when coming into contact with bodily fluids during sexual intercourse. Science has shown that exposure to this ingredient can lead to liver tumors and even cervical cancer. My favorite condoms are the ones that contain the more natural ingredients, like Trojan lambskin condoms or Glide Natural condoms. Alternative birth control option number 3, testing for ovulation and the cervical mucus method. Also known as the ovulation method, this version of birth control, the consistency of cervical fluid to determine fertility. This type of contraception does take some getting used to as a woman learns the ins and outs of her body and what is normal for her. So it's really important to use another form of protection while you're learning. Throughout a woman's natural cycle, you produce different forms of cervical mucus, and being able to recognize these different types of fluid and what they mean is key in preventing pregnancy. In this method of birth control, women check their cervical mucus daily, chart it, and determine when they're fertile. As this method grows in popularity, more resources are becoming available to women who are choosing to go this route. Phone applications like Ovia Fertility and Kindara help women track their cycle with ease. For those new to understanding the cervical mucus, this method can seem extremely confusing. In general, the discharge produced by a woman's vagina follows a pattern during her cycle. We all know about menstruation, which typically lasts anywhere from 3 to 7 days. This is followed by several dry days where a woman is deemed likely infertile. These dry days are followed by a period of about 10 wet days, where the cervical mucus goes from creamy, think lotion, to wet and watery, to sticky, think egg whites. This wet period is known as the fertile period, with the wettest or peak day being around the time of ovulation. This fertile period is then followed by about 10 more dry or infertile days before menstruation begins, and thus the cycle continues. One of the most common types of tracking cervical mucus for contraception is the Billings method. The Billings method follows 4 simple rules to help a woman prevent pregnancy. Avoid intercourse on days of heavy bleeding, have intercourse on alternate evenings of your BIP, or just the dry days following your period. When the BIP changes, wait and see, and then wait until the 4th day after your peak to have intercourse. And conducted properly, the Billings method has been proven to be up to 99% effective at preventing pregnancy. A huge advantage of this method is that the woman begins to know and understand her body, which can come in handy when trying to conceive and recognizing anomalies in her body. Another way to know exactly when a woman is ovulating is by taking an ovulation test. These tests are similar to pregnancy tests in the pee on a stick kind of way, and will tell you precisely when you ovulated. You have to take these tests at the time of ovulation, or else it's going to say you're not ovulating. Remember, the egg only survives about 24 hours after ovulation, so you want to take these tests when you are pretty sure that's your peak day. But when first becoming accustomed to your cycles, these tests can be taken daily to determine the most fertile times. A lot of women buy ovulation predictor strips in bulk for relatively cheap while they're still learning their cycles. Natural birth control option number 4. Neem. Neem is an herb that originates from a tree that natively grows on the Indian continent. It's long been used as a form of birth control. In many developing countries where the neem tree grows, conventional forms of birth control simply aren't available. So this requires the natives to search for their own way to prevent unwanted pregnancies. Though research is still limited, like with most natural things, neem oil has proved to be the most effective form of contraceptive, especially when applied as a lubricant prior to engaging in sexual intercourse. The way that neem works via lubrication is because it is an extremely potent spermicide. Studies have shown that human spermatozoa become totally immobile within 30 seconds of contact with the undiluted oil. Studies in rats, rabbits, monkeys, and human volunteers showed that when neem oil was applied vaginally prior to intercourse, pregnancy was actually prevented 100% of the time. If unprotected sex does occur, neem oil has shown to be almost a natural version of the Plan B pill. If taken within 2 to 7 days, neem oil can completely prevent implantation. While many vaginal spermicides cause severe inflammation and irritation of the vagina, neem oil left no ill effects in these tissues. Interestingly, neem leaves can also be used as a male form of birth control. Yes, you heard me right, ladies. I said male birth control. One study was done in male rats, rabbits, and guinea pigs by feeding them a daily dose of cold water extracted fresh green neem leaves. About 6 weeks, the fertility of the males was reduced by 66.7%. By 9 weeks of daily dosing, fertility was reduced by 80%. And within 3 months, it was reduced by 100%. And the good news, unlike female birth control, the infertility in rats was not associated with loss of libido or with impotence, and the animals maintained normal mating behavior. More good news, within 4 to 6 weeks of stopping the neem, male fertility returned to normal. So I just wanted to take the time here to mention one of my favorite ways of preventing pregnancy, and that's by creating my very own spermicide. I've created a product called PregoBlog. And this is literally an all-natural lubricant and an organic spermicide. What it has in it is aloe vera, coconut oil, neem oil, lavender oil, cinnamon oil, and peppermint oil. People always get a little iffy about the cinnamon oil and the peppermint oil, but those add a nice little spice to the bedroom. The neem oil, the cinnamon oil, and the peppermint oil all contain spermicidal properties, and this helps prevent those unwanted pregnancies while also offering a nice smooth glide. And natural birth control option number 5. Natural family planning. Natural family planning is kind of like the cervical mucus method on steroids. This type of pregnancy prevention combines and tracks cervical mucus, basal body temperature, and uses the calendar. This is extremely precise, like the Billings method. It takes a few cycles to really understand what your body is doing. When using this method, the first goal is to understand your cycle and what's normal for you. This type of birth control is most effective when you're committed to it and when it's used precisely. It should also be combined with other forms of birth control or abstinence on your fertile days. First, when considering the fertility awareness method, it's important to understand how your cycle and how your body works. Each month on your peak or ovulation day, your ovary releases an egg. For about 1 day, the egg hangs out in the fallopian tubes waiting to be fertilized by the sperm. It's also important to note that sperm can live within your body for about 5 to 7 days after sexual intercourse. So theoretically, you could get pregnant about 1 week after sex. If the egg isn't fertilized, it dissolves and you get your period. This means for about 7 days out of the month, you could potentially get pregnant. This is considered your fertile window, and the whole point of the fertility awareness method is to identify when this period is. As I mentioned before, the fertility awareness method also utilizes basal basal body temperature. Throughout the month, your temperature normally fluctuates, increasing slightly after ovulation. In order to properly identify and record your basal body temperature, it must be the first thing you do every morning. Before checking your phone, before going to the bathroom, check your temperature. You want a thermometer that goes to the 100th degree, meaning that it goes 2 decimal places instead of just 1. For instance, my basal body temperature was 97.68 this morning. Some people record these numbers on paper, but apps like I mentioned before can be way more helpful to keeping everything organized. Some, like OvuView, will even predict your fertile window for you. Along with tracking cervical mucus and basal body temperature to identify fertility, many women also use cervical positioning. Throughout your cycle, just like the mucus, the position of your cervix actually changes. During your period, your cervix is firm, like the tip of your nose, slightly open and close to the opening of your vagina to allow blood to pass. The cervix remains this way until you approach ovulation, when it softens, like your chin, and goes higher into the vagina. As you ovulate, your cervix continues to soften, think like pursed lips, and goes so high and so soft that it almost blends into the vagina walls. At this point, it's when you've probably entered your fertile window. One great way to identify your fertile window is by using the acronym SHOW. Soft, high, open, and wet. In the period directly following ovulation, the cervix begins to harden, close up tight, and lower into the vaginal canal once again. And finally, the last component to the fertility awareness method is calendar tracking. Tracking your fertility on a calendar takes a bit more time, about 6 months. On a calendar, thankfully many fertility apps do this for you, calculate the length of your cycle. This can be done by counting the number of days between the beginning of your first period and the beginning of your next period. Many women are simply just tired of the status quo and dealing with the negative side effects that come with conventional birth control. For this reason, more natural versions of pregnancy prevention are popping up everywhere, like the fertility awareness method. Not only are these options more appealing because of their lack of side effects, but they also give the woman the chance to become pregnant when she wants to. While after stopping traditional forms of birth control, it can sometimes take months or even years to ovulate again. These choices allow you to become the boss of your own body and allow your own natural hormones to run the show. Thank you for joining me for our very first Wellness Wednesday, and I'll see you next time.